Now, let us bring all of this anatomy into the clinical domain by examining the progressive failure of articular cartilage, osteoarthritis, the most common joint disorder worldwide. At the top of the figure, we see early degenerative changes. The once glassy, smooth surface of hyaline cartilage begins to show fibrillation, small surface irregularities that roughened the gliding surface. Microscopically, the extracellular matrix begins to lose its integrity. There is increased water content and a loss of proteoglycans, which weakens the compressive strength of cartilage. Superficial fissures form, and the earliest bony response appears as sclerosis, or thickening of the underlying subchondral bone. On radiographs, this stage may present as subtle narrowing of the joint space. Patients at this point often report stiffness after activity or pain with prolonged use. Moving to the middle, the illustration depicts advanced degenerative changes. Now, fissures extend deeper, even penetrating into the subchondral bone. Enzymatic degradation accelerates the thinning of cartilage, and fibrillated fragments may break off into the joint space, provoking reactive synovitis as the synovial membrane responds to debris. The joint space narrows further, and the bone attempts to stabilize itself by producing osteophytes, or bony spurs, at the margins. This is the body's attempt at increasing surface area to distribute load, but clinically it contributes to pain, stiffness, and decreased range of motion. Patients begin to lose function, with difficulty in activities like climbing stairs or rising from a chair, especially when the knee is affected, the most common joint involved. Finally, at the bottom, we see the end-stage degenerative joint. The articular cartilage is completely lost, leaving the subchondral bone exposed. This is the dreaded bone-on-bone articulation. Subchondral bone becomes thickened and develops cysts, fluid-filled cavities caused by microfractures and intrusion of synovial fluid. Capsular fibrosis sets in, further restricting motion. At this stage, pain is often constant, disability is severe, and conservative measures rarely suffice. Radiographs will show the classic triad: narrow joint space, osteophytes, subchondral sclerosis, and subchondral cysts. Now, look at the summary box below. The pathophysiology is described as diffuse wear, erosion, and degeneration of articular cartilage, with increased water content, disorganized collagen, and breakdown of proteoglycans. Etiology can be primary, most often idiopathic, without a clear cause and very common in the elderly. Secondary osteoarthritis arises from trauma, dysplasia, or other joint disease. It is without question the most common form of arthritis, affecting weight-bearing joints, such as the knee, hip, and spine, but also smaller joints like the distal interphalangeal joints, the proximal interphalangeal joints, and the base of the thumb, or carpometacarpal joint. Symptoms progress from activity-related pain to persistent pain and loss of mobility, as bone grinds against bone in the absence of cartilage. Radiographically, as we said, you look for 4 hallmarks: narrowing of the joint space, osteophytes, subchondral sclerosis, and subchondral cysts. Treatment depends on the stage. Early disease may be managed with rest, activity modification, physical therapy, and medications like NSAIDs. Intra-articular steroid injections can reduce inflammation, though their benefit is temporary. As disease advances, bracing or joint-preserving procedures may be attempted, but in end-stage arthritis, definitive treatment is arthroplasty, or joint replacement, which restores pain-free mobility by replacing the diseased surfaces with prosthetic components. So osteoarthritis is not simply wear and tear, as it is often described. It is a complex, progressive failure of cartilage and bone with biochemical, mechanical, and cellular contributions. Its clinical course mirrors exactly the anatomical changes you see on this page, from the first fibrillations in the cartilage to the exposed bone and cystic changes of the final stage. Please subscribe.